The country has seen a drastic drop in the number of COVID-19 active cases, but fears of a possible third wave are real, with scientists saying they expect the third wave of COVID-19 to most probably hit the country at the end of next month. Professor Alex van der Heever is with the Wits School of Governance, and he joins us right here on SA Today. Good afternoon to you, sir, and welcome to our program. How valid are the fears of the third wave?
I think they are quite valid. The timing, of course, of any potential third surge can't really be predicted with any accuracy because it is very dependent on human behavior. And we have a number of high-risk periods coming up in which people may socialize in ways that result in super spreading events. And I think that is really where the second surge picked up coming into the end of November into December. So I think that we have to be incredibly careful and watch very carefully. And we will probably only discover the surge with a bit of a delay because our reporting systems are a few weeks after the surge tends to occur. So this is part of the difficulty and the risk that we face.
So when we are hit with the third wave, what will happen? Will there be also a variant as well?
That's very difficult to say because it can be that a variant is sort of opportunistically well placed within some of the key super spreading events that drive a third surge. So we can't be sure whether or not that will be that a particular variant will be prevalent. So it's quite possible that the second surge opportunistically benefited from a variant that was central to the super spreading events that initiated the second surge. And we will just have to see what occurs. But it's very probable that at least the variant that occurred in the second surge will be very prevalent in the third surge.
And will it be more deadly?
That's very difficult to tell because there are indications that a degree of immunity is built up from people who have been infected in the first two surges. Also extrapolating from the excess death information, it suggests that a lot more people have been infected than what has been publicly reported. So given that, we may have some people who would have been at risk in the past, but would now only face reinfection. And under those circumstances, they may still be infected and they may still transmit, but they may not develop severe illness. And for others, particularly those infected in the second surge, may in fact have quite a high degree of immunity from all variants. So I think that there are those unknowns, but there is an indication that reinfection rates are relatively low, and that could be something working in favor of a less deadly third surge. But the problem really is that there's still quite a lot of people who are susceptible to infection under quite a lot of estimations. And so so we could still face a sort of fairly large number of people who are infected. And if that occurs and the people haven't been infected in the past, then there is the possibility of some severe illness. But I do not expect, I think there's no expectation that any variant that we've got results in more severe illness than for instance, the initial sort of wild virus that was infecting us in March, April of last year.
I mean, like there have been studies about Pfizer-BioNTech vaccine, which is 10 times less effective against, the 510YV2. But of course, Pfizer is saying that the current vaccine is likely to protect against, this variant. What do you make out of that?
Yeah, so we are also unsure about the impact that the AstraZeneca vaccine would have had on severe illness and death. It's quite possible that it would have had an impact as well, although it wasn't shown to be effective in preventing infection itself. So the Pfizer vaccine may be in the same position. We don't have enough information on its effectiveness in preventing infection. But I think that a lot of these vaccines are providing some base level of protection. But it is very likely that we will require booster shots at some point during the process of 2021 and 2022. But a problem that we have now is that we were sitting with the potential for 1.5 million doses of AstraZeneca, which didn't have to be used for frontline healthcare workers, but could have been used for our high-risk groups. And we could have started vaccinating already last month, but we've held back and we've given those doses away. So there is a big problem that we're going to have a lot of people who are vulnerable to severe illness, who haven't been infected before, who are have nothing between them and the virus other than our general prevention strategies, but no vaccine. But I think that that's a mistake. We should have vaccinated with what we had.
Well, so far, one would say that the country has really made progress in terms of acting proactively against the second wave and vaccinating frontline workers. Given that we haven't gotten to a stage where we have vaccinated the population and we don't even have herd immunity at this stage, is there going to be reversal of the gains? I mean, like, also we are now at level 1. Should we expect to take a few steps backwards, even, you know, in terms of lockdown implications around the Easter holiday period?
I don't think that we can really back off from restrictions at this point because we really, although we have managed to vaccinate around just over 100,000 frontline healthcare workers, we're nowhere close to vaccinating all the frontline healthcare workers, and many of the people who are vulnerable in frontline public services that put people at risk of infection. Plus, we've got the vulnerable population not infected. And 100,000 over several weeks is not very good as a rollout strategy. But the vaccinations that we've had to date have been part of an expanded trial rather than a proper rollout. We're still actually waiting for a full-blown rollout. So I'd say at this stage, we're not in a good position in terms of vaccinations. And we probably aren't going to be able to start vaccinating at any kind of scale until probably August, September this year, which means that we are very likely to face at least one surge of new infections without any real vaccination strategy in place. So unfortunately, we're in the position where we're probably only likely to vaccinate to herd immunity in 2022, and that is very far from ideal.
All right. Thank you so much for making time for us, sir.
Thank you.
Professor Alex van der Heever, who is with the Wits School of Governance.